In this edition of Your Alberta Online, taking another look at land use planning legislation, more MRIs across the province, and efforts to reduce peak emergency room pressures are working. Now, here's your host, Barry Harrison.
Welcome to Your Alberta Online, a regular webcast to help you stay connected to Alberta government news and events. First up today, the Alberta government is reviewing two recent pieces of legislation to ensure they meet the original purpose and reflect government's commitment to landowners. The Alberta Land Stewardship Act allows for the creation of regional plans that outline land use across the province. And the Land Assembly Project Area Act clarifies how government acquires land for major long-term transportation and water management projects.
There's a lot of fear-mongering going on, and it's actually not correct. So what we're going to do is go in and clarify areas in that legislation where there is misunderstanding about the intent of the legislation. And I can give you an example. People are concerned that we can take away their land title or take away things like their freehold mineral right. That is absolutely false.
The laws were intended as tools to allow the province to meet the needs of a growing population and economy and meet Alberta's infrastructure needs. Thousands more MRI scans are being done in Alberta. About 166,000 MRIs are performed in Alberta each year. With the province's commitment to stable 5-year funding for Alberta Health Services, about 9,000 more MRIs can be done between now and the end of March, reducing wait lists.
Stable 5-year funding means that we have a better predictability with managing our activity and our growth in the entire province, actually. And having that predictable funding, we can adjust along certain courses of the year to be able to maximize capacity and respond to demands that happen. So in this end of the fiscal year, with the predictable funding, we're able to add an additional 9,000 exams and still stay within our sustained budget.
Early indications are that province-wide steps aimed at reducing peak pressures in emergency departments are having the desired impact. The protocols, put in place in December, are helping staff and doctors provide more timely access for patients needing emergency room care and are reducing the number of patients in emergency rooms waiting to be admitted to a hospital bed. The Alberta government is helping unemployed older workers learn new skills to assist them in finding and keeping new jobs. The Targeted Initiative for Older Workers is a joint initiative signed recently between Alberta and the federal government. The program provides employment assistance, skills upgrading, and work experience to help unemployed older workers.
When I was in my 20s, it was capable of going out and just finding work. If you left a position on a Monday, you could go out and be working again by Tuesday.
You know, internet search and applying online, formatting, doing a resume on the computer, those are skills that maybe the older worker isn't familiar with, but we're able to help them here in our Labour Market Information Centre.
The program is expected to help about 1,600 Albertans between 55 and 64 seeking to retrain and return to the workforce. More information is available at the web address on your screen right now. And Premier Ed Stelmach recently announced that he won't run in the next provincial election.
Upon much reflection and consultation with family, close friends, I have determined that after 25 years of public service, I am not prepared to serve another full term as Premier.
The spring session of the Alberta Legislature begins on February 22nd. That's it for this edition of Your Alberta Online. Your Alberta Online is also on Twitter and Facebook. If you have a question about the Government of Alberta that you'd like answered on Your Alberta Online, you can let us know through Facebook. Tune in next time for more Government of Alberta news. Thanks for joining us.